One major advantage of the digital era is quick access to information, but there's also a disadvantage because not every information out there is actually correct. Thanks to Google, now everyone can search their symptoms and make a diagnosis for themselves. Most of the searched symptoms are in areas of infections like sexually transmitted infections and urinary tract infections. So if you're a Google certified doctor, please keep watching so you can learn the difference. And of course, if you still have questions, go right to the comment section. Now, the names are pretty self-explanatory. Sexually transmitted infections, or STIs, are infections that are gotten through sexual contact. Urinary tract infections are infections that can occur within the urinary tract. That's when bacteria gets into the urinary tract. And that can happen when you hold your urine for too long, or for women, when you do a number two and then you wipe from the back to the front. Now, the urinary tract are channels that actually involve the production of urine, transport of urine, storage, and of course, exit. So this involves the kidneys, the ureters, the bladder, and of course, the urethra. But in men, you also have prostate, which forms part of the urinary tract. Now, with STIs and UTIs, some symptoms can overlap, like dysuria, which is painful urination. You usually find that in UTIs, but you can find that in STIs like chlamydia and gonorrhea. So let's actually know what the differences are. With UTIs, you're likely to find very frequent or urgent needs to urinate, and that's usually accompanied with pressure in the lower abdomen or in the pelvic region. You would also most likely find urinary retention. So there's retaining of urine in the bladder. So even when you go to urinate or when you do urinate, you still feel like the bladder isn't completely empty. You're also most likely to find a foul-smelling urine that's dark or cloudy. Now, with STIs, one of the very common symptoms are rashes, blisters, or sores within the genitals, both in men and in women. You'd also have discharge, vaginal discharge or penile discharge. And of course, in women, they can also have pain during sex, or they can have spotting in between their periods. Now, while all of this can happen with STIs and UTIs, these symptoms are non-specific because there are so many other reasons why all these symptoms can occur. So if you're not sure, do well to see a doctor so you can prevent possible complications and then you get appropriate and proper treatment.